Good morning, everyone. Hey. I'm so grateful to be here on the stage again of Recovery Reinvented and be able to provide an update about the work that's happening here in North Dakota. One of the main things that I've learned so much over the last 8 years from the governor and also from working with the First Lady is just how lucky we are to have such leadership in our state. I'm honored to have had the opportunity to be a part of this movement, Recovery Reinvented, and all the rest of the work that's happening in behavioral health. You know, sometimes in your life, you're lucky enough to know that you're in one of those moments that you'll look back in someday, and you'll say, that was part of the good old days, or, you know, those really important times when you connected and did something really important. And we're living right now in one of those moments for me. Governor Burgum has been an inspirational leader. He has challenged our team to think big and to challenge ourselves to do bigger than what we even think we can accomplish. This year, our Health and Human Services team proposed a goal that not only should we advance our behavioral health efforts, but that we should end addiction. Imagine a world where addiction doesn't exist. What does that look like? Ending addiction would bring a range of profound benefits to individuals, family, and society as a whole. With addiction eliminated, there would be a reduction in these health issues, potentially extending lifespans, enhancing quality of life. Addiction is deeply tied to mental health struggles, such as anxiety, depression, and trauma. Ending addiction would likely alleviate a major source of emotional suffering and mental illness. Addiction often strains or breaks relationships, which can have a significant impact on our families. With addiction out of the equation, families could experience deeper bonds, emotional stability, and improving outcomes for children and strengthening our support networks. Addiction has an enormous financial impact, from healthcare costs to lost productivity, to law enforcement expenses. Freeing society from addiction could reallocate billions of dollars to education, healthcare, housing, the social problems that we're all working to address, and enhancing our overall quality of life. Many crimes, as you've heard today, are related to addiction, and approximately 85% of the people incarcerated in North Dakota have addiction issues. Without addiction, crime rates could decrease significantly, creating safer communities and reducing the burden on legal systems. But as a parent, imagine a future where your child doesn't know what addiction is. Can we imagine the day when addiction no longer exists? I think every day we get closer. And in North Dakota, we're seeing change happen every day. Just in the past 8 years, we've seen significant advancements and successes. For the first time in years, we're seeing decreases not only in overdose, but also in suicide. We're starting to see access to treatment services growing. When we started this effort 8 years ago, there were 75 treatment programs in North Dakota. Today, there's 107. Residential increasing from 25 residential programs to 40. We've seen opioid treatment programs that didn't even exist prior to 2016 go from 1 to 4, actively serving 1,125 people in those programs. Currently, our substance use disorder voucher has allowed more than 8,500 people to get a service from a private provider that prior to this program, they would have had to seek services from providers that potentially were further away from their home or not of their choice, or even going on a waiting list while they waited for services. 8,500 people. The Free Through Recovery and Community Connect programs have filled a gap in recovery support services that we identified 8 years ago was a significant need for our state. And to date, more than 14,000 individuals have been served by those two programs alone. And housing, such an important issue for us to address in our state. Our Recovery Housing Assistance Program has served over 1,100 individuals in the short time the program has been in existence. But not only are we helping people to have housing, but we're seeing improved outcomes. For example, 8% of participants saw improvement in their employment with an average income growth of 149%. 72% saw improvement with their criminal justice involvement. 81% reported reduction in their emergency room use for non-emergent reasons. And 90% saw improvements with overdose risk. And there's already been a lot of focus today on peer support. Utilizing our lived experience in order to benefit our behavioral health workforce has been a key strategy of North Dakota. Since the beginning of Recovery Reinvented, the Behavioral Health Division has supported 48 peer support trainings, with 1,258 individuals completing the trainings. Thank you. I know many of you are here today, and I just want to point out that in partnership with legislators, we not only trained individuals and provided that opportunity, but we completed created peer support certification so that we could create a pathway towards reimbursement. We currently have 355 certified peer support specialist 1s and 36 certified peer support specialist 2 that are certified in the state of North Dakota, again, something that didn't exist 8 years ago when we started this work. Peer support has been an established part of our behavioral health workforce, and it's so important to note that we continue to work on reimbursement, whether that's from Medicaid, Blue Cross Blue Shield, or many of the state-funded programs like Free Through Recovery or Community Connect, and continuing to look at our lived experience as a key component of our behavioral health system is vital in advancing our behavioral health workforce. Also, overdose prevention is so key for us. Many of you have received Narcan at this event over the years. We have provided on average 11,000 Narcan kits annually. We know that we have had more than 3,000 known overdose reversals since 2017 when we began this work. We've also worked to expand telehealth crisis services. We currently have 64 agencies in the state that are enrolled and contracted with Avel eCare to expand crisis services through first responders in our rural areas. We also have expanded our jail telepsychiatry services. Currently, 16 jails in North Dakota are signed up and have access to these services, with more than 399 services provided through this program from January through October. And now a few of the programs that are in the middle of being worked on or advancing right now. We are working to advance our women and children addiction residential programs and reimbursement in the state, expanding services so that parents aren't having to make tough decisions about caring for themselves or caring for their children. We are currently in contract for new inpatient behavioral health beds in the Williston region, bringing inpatient services to a region that desperately needs them, reducing family members needing to travel so far to see loved ones, and increasing those services, again, closer to home. And you heard Governor Burgum mention, but we have been working on the design of a new state hospital. Our current state hospital is very antiquated, and there are so many opportunities for us to advance our best practices in serving individuals in a trauma-informed way. And so a new state hospital is an important part of our full continuum. We provide many specialty services at the state hospital that are not available anywhere else in the state. And so having this opportunity is a great thing that we will again be continuing into this legislative session as we discuss the building of the new state hospital. And last session, our human service centers were provided the authority to begin converting to what's called certified community behavioral health clinics. These are 5 efforts that the human service centers are currently working on in order to move towards that certification. They're working on the front door experience, expanding addiction services, focusing on youth and family, enhancing crisis services, and again, looking to better serve justice-involved individuals. This will be a work in progress, and every region has different needs and partnerships, so we will be continuing to work with our private partners as we expand those services. And next, these are three key really important things that we've been working on over the years, but one is that we really need to support that full continuum of care. You heard earlier speakers talk about everything from prevention to recovery. It is so important that we provide services so that if we can prevent a need for service in the future, we do that first. And we have early intervention and treatment and recovery support services. We also want to continue to expand our partnership between public and private entities, and again, build a robust behavioral health workforce. All things that we are working on right now, but have more to do. So I just said it, but we have more to do. We've done so much and we've come so far in the last 8 years, but I think there's always opportunities to look at what we did yesterday and say, how could we do that better tomorrow? As a mother who's received a phone call before from an emotional disturbance specialist at a school, or who's had a doctor say, I'm sorry, but it's cancer, I think it's really important for us all to know we're one diagnosis, one bad decision, sometimes even just one unfortunate circumstance away from a behavioral health crisis. And we should not accept anything less than the services available when we need them and as close to home as possible. So I challenge you today to continue to work on behavioral health being treated equally as physical health. It is important that at the core of our work, there's recognition that behavioral health is an integral part of overall health. The foundational principle requires that individuals with behavioral health needs are entitled to the same level of care, access, and quality as those with physical health conditions. And in order to do that, we will need to focus on ensuring parity. So for example, behavioral health services should be provided on par with physical health services in terms of access, coverage, and quality of care. Our care should be integrated and not a separate care. Behavioral health services should be integrated into primary care and general health care settings to normalize mental health and substance use treatment and to reduce stigma. And lastly, stigma reduction, so much of the conversation today. We really need to look at how we can continue this effort so that we will continue to educate communities, healthcare providers, policymakers, and all interested parties in continuing to focus on reducing stigma and the discrimination against individuals seeking mental health or addiction treatment. I also just want to share some resources that already exist. Parents Lead is a great resource if you're looking for information on having conversations with your child or helping support a loved one. And I would also encourage everyone to visit our website, behavioralhealth.nd.gov, where you can find our mental health directory, addiction services, recovery talk, and many other programs that we have available today. Thank you.